Here is a sequence of things that you could try to help with jaw clenching or teeth grinding. This is a very common condition that people suffer from. And there's not many conventional treatments for it, but this is just something that you can easily do at home that can bring you potentially some relief. And it might help with other issues as well. So what causes jaw clenching and teeth grinding? Probably most people that I talk to agree that it has a psychological component. So maybe something is stressing you out, or you just hold sort of a deep habitual pattern of stress, or sort of a drive in you that wants to keep going, or maybe some kind of frustration. Whatever it may be, these types of conditions often cause a deep tension in the diaphragm, in the solar plexus. So even though, jaw clenching, teeth grinding is involving the muscles in your head, like temporalis or masseter, those are the actual muscles doing that. What is making them do that is probably something much deeper, a condition, you could say, in your nervous system, right? So we'll get into some specific points in the head, but I'd like to start with the hand. And there's a nice point, large intestine 4 in the hand, that helps relax the jaw and also relieve pain in the jaw. And this point is just in between the thumb and index finger, and you can feel this group of muscles here. And I'm just going to massage that group of muscles. We call this large intestine 4. Yours is pretty tight.
That's correct.
I feel that.
Yeah.
Okay. So often this point is a little bit tender and achy feeling. And that's okay, as long as you work within your level of comfort. You might feel some tenderness here. And then you do both sides in the hands. Even if one side of your jaw is more problematic, I would always do both sides of the jaw. And then I'm going to go and press in the abdomen a little bit. When you work in somebody's abdomen, you want to make sure they're breathing and into the abdomen. So when you press in somebody's abdomen, sometimes they will stop breathing here and they will just start breathing in the chest. But make sure Melissa's breathing nice and deep, and make sure that you understand also where the abdomen is. So you have your hip points and your rib cage, right? And the waist, which is the narrow part, that's where your navel is, usually, right? You can grab in between the pelvis and the ribs. People can be a little bit ticklish, so keep that in mind and try to use a larger surface area, like flat hands and firmer pressure. And just get a sense of the breath moving in the abdomen. I can massage a little bit back and forth, covering a large area of the abdomen, just to warm up and release tension in the surface. Does that feel okay?
Feels great. Thank you.
So you can communicate as well and make sure that what you're doing is effective. Things start moving around, right? So then I'll find the bottom of the sternum and the navel. Those are two. If you don't know where the navel is, you can always just ask them if you don't want to poke around or lift the clothing. Okay, so it's right here. Here's the bottom of the sternum. And I'm going to press right halfway in between those 2 points. And I'll use about 2 or 3 fingers and gently press straight toward the floor. So I'm using a vertical pressure, and you don't have to press hard here. This is a very sensitive area, and an area where people can hold a lot of tension. So as I press here, I can feel her breath moving. And depending on how much tension the person has, there may be a lot of tenderness here. And you may also feel a pulse in this area, a strong pulse. I can feel your pulse, and that's fine. I don't want to press too hard, but I'm waking it up and starting to release some tension in the solar plexus. Right? You can do that to yourself as well, but it's really nice to work with a partner so that the person who's receiving can fully relax. When you do it to yourself, you can't completely relax. Now she can put all of her mind into just really letting go and breathing. Okay, after you take a few breaths there, you can press into the diaphragm. I like to work on the right side first, so I'm sitting on her left side, and then I'm going to reach across and hold the rib cage, support the rib cage, and just gently press toward her right shoulder, about in the direction of her right shoulder. So I'm pressing up and also to the right. And don't press too hard. Make sure you don't bend or stretch the ribs at all. That doesn't feel very good. I'm just pressing into the soft tissue under the rib cage. And again, I'm using an upward pressure this direction, not straight down. It doesn't have to be very much to be effective. Right? Part of what you do with acupressure is bring awareness into these areas. So as I press here, she's doing all the work by breathing. Every breath she takes, she's doing her own internal massage, and I'm really bringing sort of a container to that, and also an awareness, a sensory awareness into that area of the right side of the diaphragm. Often the right side gets a little bit tighter than the left side. You should also do these techniques before you eat. You don't want to do this right after you eat something. Okay, so take a couple of minutes. That could be done for about 1 to 5 or even up to 10 minutes. Could be spent in the diaphragm. And then some other good points to help with jaw clenching. This is getting into the root of it. And then we'll get into some of the more the local points. I'd like to start with gallbladder 21, which is really just your upper trapezius. So you can kind of grab this muscle on the top of the shoulder and just squeeze it. Is that okay?
Yes.
Most people like the sensation there. You can usually squeeze it pretty hard, maybe for 30 seconds or up to 2 minutes, and massage it a little bit. This point is on the gallbladder meridian. It's also a triple heater, but it's just a good point to help release tension. When people have jaw tension, it's never only the jaw. You can have neck and shoulder tension associated with jaw clenching. You never know which one came first. But often neck, shoulder, and jaw tension are rooted down here in the diaphragm and the solar plexus. Remember, the liver and gallbladder are right there on the right side. Okay? And then another good point is gallbladder 20, and that's just under the base of the skull. So there's a few points back here, but Gallbladder 20 is if you find you have your earlobe and then the mastoid process is this bump on the skull, kind of behind that. Right on the outer edge of the upper trapezius, if you know anatomy, you can find some tension there, usually. It will feel like a little hole that you can sink into, and then once you sink into it, you may feel, or they may feel, there's some tension there. I'm making some little circles to loosen it up. Gallbladder 20, spend some time there. And then gallbladder 8 is right above the ear. So here, you could say about an inch above the top of the ear. And we're in sort of the back of the temporalis muscle here. And you can press pretty hard here because you're in the skull now and massage in small circles. It's a big fan-shaped muscle. It runs on the side of the head and it comes down into the jaw. If you were to press here and then clench your jaw, you would feel this muscle pop out a little bit. So that feels good usually. To loosen that up, gallbladder 8. And then the other energy channel that affects the jaw a lot is the stomach. So the stomach starts it starts here actually, and goes down the whole front of the body. So we often use this point behind the collarbone and in the sternocleidomastoid is affected by that stomach meridian. And then it goes right up into the jaw itself. So you have another jaw muscle here called masseter, and that's right on the angle of the jaw, the back corner of the jaw. So you can massage that all the way up toward the chin, right along the jawbone, and also right up under the cheekbone, and loosen that up. So that could be quite tender if a person is clenching their jaw a lot. Right? These are the actual jaw muscles, here and here. If you were to only work on the jaw muscles, I think not much would happen in terms of relief from that condition. If you were to add in the points on the hand and in the abdomen, I think if you did that regularly, you would get some real relief and maybe experience a decrease in your habit of jaw clenching, and also just become aware of these places in the body through acupressure, so that you can check in on them throughout the day. Are you clenching your solar plexus, your upper trapezius, or your hands throughout the day? It's a good place to check in.